Welcome to Bassetlaw CCG's annual general meeting for 2020. Now, this is a very different AGM to ones we've had previously. Usually in the past we've all met in person at the well, but with coronavirus the world is a different place. So for the first time we're doing our AGM virtually. You'll be able to see this at home and actually hear what great work we've been doing in Bassetlaw over the last 12 months on behalf of our residents. Afterwards, if you want to email in questions, we'll have a live question and answer session via Zoom that you can actually hear the answers to your questions. An email address will be provided at the end. As you know, Bassetlaw CCG has a lot of key objectives. We want to ensure high quality and safety in the provision of services for our patients. We want to work with key stakeholders to address the wider determinants of health. We want to make sure that the services are integrated out of hospital to support patient-centred holistic care. We want to make sure that both mental health and physical health services are integrated. And we want to strengthen the resilience, sustainability and influence of primary care across the system. Now, in Bassetlaw, we've had a number of key successes over the last 12 months. All practices are rated as outstanding or good by the CQC. We have 3 primary care networks that are well established and thriving. Under the patient survey, results for all practices in Bassetlaw are excellent. The auditors' reports have been excellent all year round, and healthcare performance remains significantly better than the national average. Now I'm going to hand over to Idris Griffiths, our Chief Officer, who will go into a little bit more detail here.
Well, welcome to Bassetlaw's AGM under slightly unusual circumstances, but hopefully we'll be able to get across the information that we need to about what happened with the CCG and partners last financial year. So my name's Idris Griffiths, I'm the Chief Officer of Bassetlaw CCG, and I'd like to run through some of the collaborative work that we've been doing throughout the period of last year. So first of all, I just want to make a general observation that as a CCG, we obviously want to reduce health inequalities and increase the number of healthy years lived. And we recognise that a relatively small proportion of healthcare provision and access to healthcare actually reduces those health inequalities, essential as they are. So about 20% is sort of access to the quality of care. So the other 80% that's impacting on people's lives are what we call the wider determinants of health. So we're looking at employment, housing, education and so on. So in order to work and address those issues, we work collaboratively with our partners. In Bassetlaw, we do that predominantly through the Integrated Care Partnership, which is chaired by Catherine Byrne, the Director of Bassetlaw Community and Voluntary Services. Together with the County Council, Notts Healthcare, the District Council and the primary care networks, which I'll go on to in more detail in a moment, come together on common programmes of work to reduce those health inequalities and support the residents of Bassetlaw. Last year, for example, we ran a campaign with all of our partners to get Bassetlaw moving more, and it was a highly successful Miles in May exercise that was carried out that saw a huge number of people participate in getting fit and active. The primary care networks in Bassetlaw have been established for some time. We have 3 networks made up of the Newgate practice, Larwood and Bawtry, and Retford and Villagers. They ensure that there is collaborative working across not just primary care, but using themes and support such as social prescribing, supporting people with sort of wider mental health issues, and making links that people can get support with advice for housing or through the Citizens Advice Bureau and so on. And our primary care networks are now maturing and expanding. They're using the investment that the government has put in through the national contracts for GPs and expanding their workforce and expanding it into new areas of supporting their patients and local residents. And wrapped around that, we have social care and mental health teams working on the same geographies, so looking after the same communities, which allows those different organisations and professions to come together and work in a holistic manner for the residents. And the other form of collaboration is at a wider system level. So across South Yorkshire and Bassetlaw, we come together with providers and local authorities and others, serving a population of about 1.5 million people. As Bassetlaw CCG, we play an active role in much of that collaborative work. And there have been initiatives that include specialising on acute children's surgery, for example, to ensure that we have the highest quality of care for children in greatest and urgent need. We've expanded nurse training across the system, with the local providers ensuring that nurses in training have got clinical placements to support them through their qualifications. Last year we implemented a hospital quit smoking service with significant investment supported by cancer funds, amongst other things, and putting in a model that we hope will increase the number of people who are able to quit smoking. And I think finally, a final example is the way that we're coming together to support the workforce. We want an equal and a diverse workforce, not just across commissioning, but providers, and as large and very important employers in the local communities. We want to ensure that over time we increasingly represent our communities in terms of the diversity of the population, bringing that in and the opportunities that that will bring to make our organisations even more effective for the general public.
Hi, my name's Hayley Tingle. I'm the Chief Finance Officer for Bassetlaw CCG. I want to present to you today the annual accounts for 2019-20. I'm really pleased to report we've had another successful year in Bassetlaw. We've achieved all the CCG's financial duties. Namely, expenditure hasn't exceeded the current income, the revenue resource hasn't exceeded the amount specified, and our running costs, the revenue administration resource, hasn't exceeded our amount specified. There's a number of other financial achievements that we've successfully achieved. We've achieved an unqualified audit opinion. We've achieved a better payment practice code with all our providers. And we've ended the year with an underlying recurrent surplus in line with our control total. The next slide just demonstrates where we've actually spent our money. 50% of our resources are invested in acute services in secondary care. We spend nearly £96 million in acute care. The next significant element of expenditure is in primary care, which includes prescribing. We spent £43 million in prescribing, which reflects 23% of our allocation. And the next one I'm just going to pull out is mental health services, which is nearly 10% of our allocation and a £19 million spend. As you can see from that slide, there's a breakdown in how we invest our money as part of the CCG. Looking forward into 2021 and beyond, we have a financial challenging period coming up. We've got a backlog of demand due to COVID-19 pandemic, and we've got cost implications of running services with COVID-19 endemic and the challenge of the clinical aftermath. Example, mental health. We've got a challenging efficiency programme going into 21-22. We've had some significant challenges of delivering our efficiency programme in 2021, not namely because of the COVID pandemic, which will create us some real problems going forward. So that we need to work on those challenges. We've also got some opportunities and challenges of working in an integrated care system. So we need to understand how resources are allocated and how that collaboration will work. Thank you for listening, and I want to present to you the 1920 annual accounts. Thank you.
Hello, my name is Nicola Ryan. I'm the Interim Chief Nurse at Bassetlaw CCG and also the Executive Lead for Quality and Patient Safety. The main part of my role is to ensure that we improve quality across all our commissioned services. Within the CCG, we've got a well-established quality and nursing team in place that consists of a wide variety of roles, including infection prevention and control, safeguarding and other key areas of quality. That's supported by our Quality and Patient Safety Committee, which meets on a monthly basis and reviews all aspects of quality and safety. This is supported by regular quality visits to our providers, including nursing homes and NHS providers, to ensure that quality of services are provided. The essential role of the governing body is to ensure that all our members focus and have quality at the heart of all the work that they do and all the discussions that they have. Continuing healthcare and personal health budgets are a key area of my portfolio, and for 1920 the CCG achieved all its national targets both for continuing healthcare and personal health budgets, and we continue to thrive in offering personal health budgets across the Bassetlaw population. For transforming care, the CCG achieved 82% of its learning disability annual health checks being completed, which is above the national target, and there is ongoing work to support people within the Bassetlaw district who have a learning disability to lead a quality and safe life. For children and young people, we continue to develop our transitions work so that children transition from children's services into adult services, and we've become part of the national transition programme during 1920. A key aspect of my role is to ensure that adults and children are safeguarded, and the CCG is an equal partner along with the local authority and police for both safeguarding children and adults, and we continue to attend regular meetings and support the work across Nottingham and Nottinghamshire. The CCG has strong support in place for all our local care homes. We have named GP leads, and we have additional support from infection prevention and control, and a head of adult nursing who does regular audits and provides quality advice and support. Our infection prevention and control team provide additional resource to GP practices, care homes, and during the pandemic provided 7-day cover from the onset to ensure that infection prevention and control practices were adhered to. Thank you for listening to my presentation. If you require any additional information, please either look on the CCG website or contact the communications inbox.